All right, my name is Dr. Kyle Daigle. I'm an American doctor, also an international speaker and an author. I wrote a book called Cracking the Code of Autism. And, I came to Dubai because really actually the vision of the leadership here, they're really big into innovation. They want to really make a big impact around the world. And because we're bringing all this innovative medical technology, my goal is to actually put a flagship here in Dubai. So I think the big thing here from what I've gathered from working with patients is that a lot of these families, they have children, for example, with autism, ADHD, and no one really knows what's really going on inside the brain. And we've developed a method and a technique that actually analyzes the brain and also all these other factors like running labs and stuff. And what we're able to do is not necessarily treat the symptom, but we can actually comprehensively tell these families what is actually going on inside the brain of their child. So NeuroSolution method was a technique that my partner, Dr. Brandon Crawford, and I developed, and it's over 3 primary pillars: energy, sensory, and movement. And we break those down. Energy actually deals with nutrition. It deals with the amount of light that we get exposed to. Movement is actually dealing with how well we move, how well we exercise. There's something called primitive reflexes that we're working on and testing. And then also sensory. We found that, the brain basically develops off of input in from something called cranial nerves. And we develop a technique and an assessment that addresses our senses. And so we do is we actually find all these weaknesses in these cranial nerves. And from that, we're able to put together a plan and a treatment that can target all these underactive networks in the brain and also address the dietary and nutritional deficiencies. Well, it's actually a personal experience. As a child, I was diagnosed with ADHD, and I was put on methamphetamines, which is actually the medication for ADHD. And I also had a speech impediment. And so I spent years in speech therapy. My parents took me to all these doctors, and I spent years, my parents had no clue why I had these issues. And after doing my own personal research and actually studying neurology, I was able to find solutions. And, I just don't want other kids to have to suffer from what I did in the past, being put on a medication that completely destroyed my life. I mean, I had no social skills. All I did was basically want to read books nonstop. And then also just the fear of actually public speaking in front of people gave me like anxiety. So, my passion actually comes from a personal experience of, being diagnosed with ADHD and then being put on a medication that no one really actually knew why I was even having ADHD in the first place. So, my focus in my whole career was actually trying to find a way to fix myself. And now that I'm a successful, doctor and also international speaker on behalf of this, I really want to come to the Middle East here and actually help all these families and their children, be the kids that they deserve to be. So ADHD, it's kind of a complex neurological disorder. And really, when you break it down, it's hyperactivity in the brain. So there's one way that we test this is actually through something called QEEG. It's actually an EEG. So we actually look at the brain waves. And that's what you're seeing is abnormal brain waves. And so what we're able to do is actually see where all these hyperactive networks are and hyperactive brain waves, and then we can see all these underactive. And what's cool about the brain is that the left and the right side of the brain, they actually work together. And so when you have these abnormal networks that are overfiring here and under over here, that right there can create hyperactivity or also ADHD. There's also some genetic aspects of ADHD. There's something called the MTHFR. It's actually a B vitamin that these patients normally they have this genetic expression. Normally it could be passed down from mom or for dad from a genetic aspect. And then there's also this gut-brain connection that nutritional deficiencies can actually mess with the neurotransmitters in the brain. And, in ADHD, what really you need to look at is actually what does the brain look like? What does the nutritional deficiencies look like? And then also, what does the brain chemistry look like? And if you don't have enough of dopamine, for example, the chemical that, basically causes ADHD, if that's low, then you need to basically increase that. But then the question is well, why is it low in the first place? And that's what we're designing here. This is what we're here to do, is actually find, the actual root issue. Okay, so a lot of symptoms of ADHD in adults could be, you can't sleep at night. Maybe you get OCD. You get these fixations. You get anxiety. You can get irritable really, really easy. Maybe you start forgetting things, or maybe you even have this crazy hyperactive memory where you can memorize everything. So those are some common symptoms that we can see in an adult with ADHD. Okay, so the way we look at ADHD is, first of all, it starts with a proper assessment. So we really want to know exactly what's going on in the brain. So we actually do testing to see what the brain waves look like. The next thing we actually do is actually evaluate the eyes. Very interesting that the eyes are actually considered the gateway into the brain. So we look at these eye movements, and we also look at something called your pupil size, how well your pupils constrict. And then the other way we do is we actually run laboratory testing. We run multiple things: stool samples, urine samples, blood samples. And our goal is to actually figure out, is there any inflammation, which is a stress response in the gut, because there's this gut-brain connection? Or is there any nutritional deficiencies? And what we're finding is that this chemical dopamine, which is what the brain needs for concentration and coordination, we're finding nutritional deficiencies in the pathway that produces dopamine. And so once we get this full assessment that there's abnormal brain waves, the eyes and stuff aren't moving, there's nutritional deficiencies, our team, we put together this plan of actually treating this. Now, how do we treat ADHD? We look at photobiomodulation, which is called red light therapy. We can actually laser this thing on top of the actual scalp or these underactive networks. We do eye movement therapy. I actually developed a video game called NeuroSage, which is a computer game that uses acoustic stimulation and also eye movements. And that, it's very interesting that, people get on social media and they scroll. And they can scroll for days because vertical eye movements actually help the brain produce dopamine. And so what we did is we made these video games that these patients actually play in conjunction with all these other sensory stimulations. And it's pretty unique because we actually work on balancing your equilibrium. We work on exercises. We also work on something called the vagus nerve, which is this nerve that, it's kind of this new research in this gut-brain connection. And we just develop a full, multi-sensory approach to actually help people out with ADHD. I think the whole thing with ADHD is that, if you come in there and you say you have this hyperactivity, you can't focus, the question is well, why? And that question, why, needs to be addressed, because you can get put on a medication and temporarily maybe it might work, but then eventually, you need a higher dosage. And then you need a higher dosage. Well, then if you never get to the root issue, then one, you're going to be taking multiple medications. So the goal is to actually figure out why. And that right there is there's this component called the gut-brain connection. And what we're finding is that there's abnormal functioning in the gastrointestinal tract, and that is directly impacting the brain. So in saying that, really what someone should really do is actually look at something called the dopamine pathway, which is how the brain produces dopamine in the first place. And we're finding that there's nutritional deficiencies that are actually in this chain that need to be addressed, so that way these patients can naturally get dopamine, so that way they don't not dependent upon taking a prescription drug for the rest of their entire life, like what happened to me. Okay, well, it starts off with, once we get an actual scan of the brain, so once we get this QEEG, we kind of have a good idea as to what basically is underactive, what's working. And so from that, we can see maybe there needs to be vision therapy, maybe there needs to be sound therapy, maybe this person needs to do certain exercises. Or in a lot of times these kids need a lot of sensory stimulation. So once we scan the brain, we get a good idea as to what's underactive. Then we also do this other assessment where we're looking at the actual face. And we actually observe all the senses, how well you smell, how well you see, how well you hear. We also look at the facial tone. And then from that right there is going to be a direct reflection of the brain health. And then also, again, back to talking about labs, we run all these labs, and from all this, we determine whether this patient is going to need to do something called an intensive, which is where they're going to spend anywhere between 16 to 20 hours of stimulation on a weekly basis, or can that person do traditional therapy in our clinic? Maybe they can come, a couple of times a week for, 6 to 8 weeks. Photobiomodulation is this whole new thing. It's also known as red light therapy. But when you break down photo, that means light, bio means life, and modulation means alter. And so what we're seeing is that light can alter life. For example, take a plant and put it inside the house and don't give it any sunlight. That plant is going to die. Okay, and something very interesting about here in the Middle East from what I've seen is that all of my patients that I've seen in the States that are from here all have low vitamin D. And vitamin D is an extremely important nutrition or vitamin that's actually used for the immune system and also for brain health. So the concept that we do is based off of, light exposure. So, one of my favorite scientists, his name's Albert Einstein. And Albert Einstein came up with this equation, E equals mc squared. And I'm going to break that down for people listening. Energy is what E stands for. Okay, so everyone here has to drink coffee, they're drinking Red Bulls, they're drinking energy drinks, having to drink lots of caffeine because they don't have very much energy. And the question I want to ask people is well, why? So energy equals mass, M. That's every cell in the entire body, okay, times c squared, which is the speed of light. And when you break down light, there's a multiple color array. You have blue, indigo, violet, red, orange, all these colors. And what's happening is that if your energy is low, that is going to determine that you're not outside in the sun or you're not being exposed to the sun. So in saying that, photobiomodulation, we're using light, red light, violet light, blue light, green light to actually apply to different parts of the body to enhance the energy. I think that most of these patients who have a lot of inflammation, so for example, kids on the spectrum, kids with autism, people with ADHD, patients with multiple sclerosis, people with traumatic brain injuries, spinal cord patients, patients with diabetes, diabetic neuropathy, and even patients with like autoimmune diseases like celiac disease, Crohn's disease. Those are some really good, cases that we've had a lot of benefit working with. QEEG stands for qualitative electroencephalogram. So what it is it's just like a regular EEG. So it's people who have seizures. They go to the doctor, and they actually put this little skull cap on the head, and then they're able to see all these brain waves. So all the Q is basically what it does. It takes all the brain waves and it puts a map of the brain. So it shows you different brain waves. For example, delta waves when you go to sleep, beta waves when you're alert, high beta waves when you have ADHD or you have these high-level anxiety. So what it is it's going to show you exactly a map of what all your electrical activity in the brain looks like. Something interesting too. When I work with patients who have spinal cord injuries, and what I do is they come and see me and I actually do this test and they're like, well, doctor, I have a spinal cord injury. Why are you checking my brain? And I'm like, because the brain controls everything, which is why we developed NeuroSolution. The brain's a solution to everything. So when I assess their brain, I actually see that this area of the brain that controls all their muscle function, it's underactive. So these patients have spent years trying to rehabilitate their legs or their arm to get their arm to move, but the part of the brain that controls their leg is underactive. And there's a concept in neurology, if you don't use it, you lose it. So if you've been paralyzed for years, the brain itself is going to start to adapt because it's not getting feedback back. And we can actually see when we run these scans on these patients' brain that this area is actually underactive. I feel bad because I see these patients that they've sent, 40 something doctors just to get their foot to move and nothing's worked. And so they start losing hope. And then they've been coming to the United States to see us. And we've been able to see that from running these images that the part of the brain that controls their leg, it's underactive. So even though they've been seeing some of the best spinal cord rehab doctors and the best physiotherapists, the part of the brain that controls their muscle function is underactive. And if you don't know that that's it, then how are you going to address it and treat it? So we're treating the symptoms instead of actually looking at the part of the brain that's controlling muscle function. And that's our primary focus in NeuroSolution, is to actually always, in every case, go to the brain, assess the brain, find different areas in the brain that are underactive, and target those. Really kind of anything. The brain controls everything. So you're looking at ADHD, cerebral palsy, genetic cases, seizures, chronic pain, traumatic brain injuries, spinal cord injuries, multiple sclerosis, dementia, patients who even have something called vertigo, dysautonomia, diabetic neuropathy. These are all things that can be addressed from actually doing a brain-based program. Primitive reflex integration it's these infant reflex that we're born with. And what happens is as we apply sensory stimulation, for example, kids who actually learn how to breastfeed, is that what happens is whenever a bottle is put on the face, the kid turns and latches. And that right there actually is going to start to stimulate the brain. What's happening is these reflexes, one, they're not being tested, but two, these reflexes are something called retain, meaning they're not going away within their respected time frame. So when we assess these kids with developmental delays, autism, ADHD, dyslexia, we're finding that these kids have these retained primitive reflexes. So a primitive reflex is an involuntary movement that's actually from a sensory stimulus, and it's supposed to go away in certain time frames. But the problem is it's not going away. So the brain itself is staying immature, and then other parts of the brain are becoming hyperactive. And that right there can turn into something called ADD or ADHD. There's multiple areas or ways to test primitive reflexes. So one of my favorite ones to actually check is something called the Palmar reflex. So all these children who are nonverbal autistic, what we do is we actually can literally take their hand and then we actually can run like an X on their hand, and there should be no movement. But what happens is when we do this, they actually grasp their hand like an infant. The same thing goes to the face, is that I can actually stroke the face, and what happens is there should not be any movement. But what we're seeing in all these kids that are nonverbal is that when we do this, they actually turn their head or they actually stick their tongue out. And that's not supposed to happen. This is actually supposed to happen in infancy, but these kids are actually seeing this. So what happens is once we find all these retained reflexes, these reflexes go to a certain part of the brain called the brainstem, which is where they're housed, and these reflexes mean that the brain itself is immature. So in order for the brain to actually work efficiently, these reflexes must go away. And then we're seeing these reflexes actually return in adults. For example, emotional trauma, someone has maybe a traumatic brain injury. I was talking to someone today who actually was involved in a motor vehicle accident, and this lady actually lost the ability to hear. And so I was talking to her about now she had anxiety. And so if I were to actually do a full assessment on her, I would actually find that she's having return reflexes, which are infant reflexes that have return. And so now she's, having agitation issues that she didn't have before, just like an infant. Yeah, well, we see primitive reflex integration really surface in children on the spectrum. So when we see these children who are nonverbal autistic, what's happening is in order to try to get these kids to actually start to articulate and express their words, we need to actually look at their primitive reflexes. So I have a child that I've done a lot of primitive reflex work on, and the amazing thing is that this little kid, Isaiah, is now actually verbal. The vagus nerve, it's this nerve that actually comes from an area of something called the brainstem. And what it does, it innervates all your organs. It also can activate your immune system. It can also help out with reducing inflammation. And so we found from doing diagnostic testing that we can actually find weak vagus nerves. And once we find this nerve, we can actually stimulate it with something called a stim pod. It's actually a device that NeuroSolution actually, we sell. And so from doing this, what we do is we stimulate this vagus nerve, typically by actually something called auricular branch inside the ear. And it's this really amazing little pin, and it actually sends this electrical impulse. And then from that, what can happen is we can actually reduce patients who are having inflammation. Maybe someone has pain. Maybe even someone has digestive issues like constipation, that this vagus nerve stimulation can actually help have a positive impact on those symptoms. I think that's a hard question to answer because, the brain controls everything, So we've worked with patients in the States who are on hospice, which are patients who are actually literally just trying to live a couple of extra days. But the brain controls everything. So, the brain controls your pulse and your breathing. So if you're having, pulmonary issues, you're having skin issues, you're having muscle weakness, pain, the brain actually, if proper stimulation, you can at least help some sort of benefit within those symptoms. I think that, stool samples are probably one of my favorite tests to run because, no matter what you have, you take a pill. You have a headache, you take a pill. You have allergies, you take a pill. You have stomach issues, you take a pill. So what I really like to do is actually really assess something called the gut microbiome. It's actually the bacteria in the gut. So I love running stool samples. The next thing I like to run is something called an organic acid panel. It's a urine sample that looks at basically really what's all going on in your detoxification. How well is your body getting rid of toxins? And then the third thing is actually something I've seen here very frequently is something called mycotoxins. It's actually mold exposure. Very interesting thing about the Middle East is that you guys have a lot of sand here, and that sand can get embedded into the HVAC system. And if it gets into the HVAC system, you can get this high humidity, and that can actually promote mold and fungus growth. And, that can get basically dispersed throughout the house, through schools. You breathe this in, and anything in your nose can have a direct impact into the brain. Yes. Years ago, what happened is I was doing research on trying to figure out, was there any potential pathogen, maybe an infection in kids on the spectrum with autism? And what I found is that there was a lot of common things. There were abnormal gut bacteria, but the biggest thing that I found across the board was actually something called ochratoxin A, and it's a fungus. And that fungus, what it is we found from all of our children that we've tested on the spectrum, they've tested positive for ochratoxin A. So the higher the level of this ochratoxin A, the higher the probability this kid's going to be nonverbal. So in order to get these kids to actually try to potentially vocalize, we actually have to basically reduce this ochratoxin A. And the interesting thing about ochratoxin A is that it can be found in the environment, for example, in the HVAC system, but it also is found heavily in carbohydrate foods. And most of these kids that we work with, they eat carbohydrate foods, breads, pastas, crackers, rice, and milk. And these things actually feed the growth of ochratoxin A. So multimodal sensory stimulation goes to the concept, what wires together, fires together. So we found in neurological rehab that the more sensory information that we apply to the brain, whether it's stimulating the eyes, stimulating the face, stimulating something called cranials, all your senses. And if we do this simultaneously while we perform exercises like primitive reflexes or core exercises or sensory exercises, that we're able to get more sensory stimulation to the brain so we can get faster results. When you're looking at autism, really it looks at like you have to really understand what's really going on inside the brain. And when we see these kids, we're seeing that there's a lot of underactivity in a significant part of the brain. So that's going to kind of determine outcomes as to how fast. But autism, when someone really gets this diagnosis, they kind of carry it for a very long time. So our goal through proper intervention is to actually shorten the symptoms that parents actually see. So some of the things that we've been able to actually accomplish with our methods is actually better eye contact. We've been able to enhance coordination, improving muscle tone. We have a significant amount of kids who are now actually becoming verbal. And one of the kids that we've actually, just recently worked with is that he developed a first friend. And, as a parent, we all want our kids to be able to grow up in the environment, be able to be a normal child, have friends, to be able to socialize. And, on our behalf, because I'm actually a parent myself, is for me to see this kid actually be able to develop and have a new friend. As a parent, really, we just want our kids to be accepted. And so we've been actually able to help a lot of families with actually improving the overall symptoms that they say, based off of them having autism. So, it just varies. Some of these parents, when we actually run these labs and they see that their kids got a lot of infections, it's kind of alarming because it's really not just saying, oh, my child has autism. Yes, your child may have autism and all these characteristic of symptoms, but your child also has like 3 infections and his whole entire brain is completely underactive. So again, I kind of push the autism kind of diagnosis to the side. And what we want to do is really focus in on all these things that we find that are positive. And we start actually working on eradicating and removing these. And then what happens is these autism symptoms can actually start to reduce. One thing we're seeing with autistic children is when we scan their brains, there are certain areas that are very overactive. For example, sometimes we're seeing the left frontal lobe right here. Certain regions are very hyperactive. And that area is going to deal with all these kids that are basically like lining up all these toys. These are the kids that are listening to the same YouTube channel over and over again. And then what we're seeing is right here on the right side, this area is like very underactive. And that's the area that's going to calm things down. It's going to stop the brain from wanting to basically have these fixations. And it's also going to deal with the same area of the brain for coordination. So these kids, they're super gifted and they can memorize numbers and patterns. I mean, these kids are phenomenally smart and brilliant. But the problem is that the brain itself, the left and the right side of the brain, they're not really talking together. And so what we try to do is basically bridge that gap by trying to make the left and the right side completely work together. And that's where if we can do that, then we can actually see a different child. No, but we do actually have a medical procedure called the V-cell. So it's a very small embryological treatment that was similar to something called PRP. So what we do is we actually do an intravenously, we do a blood draw, and we actually spin the actual blood. And then we actually use this really high power laser that we actually laser the blood, and then that's actually injected back into the patient. So that's called our V-cell procedure. And then we have something called our photobiomodulation PRP. Basically just means red light PRP. Same concept. We actually draw the blood. But what we do this time is we actually inject this intramuscular. So this is actually our, and our neurologist and neurosurgeon actually do that. So really it goes back to we address all developmental delays from the same concept. We study the brain, so we do diagnostics, we do full laboratory testing, and we do a very comprehensive neurological exam. So once we can figure out what's working, what's not working in the brain, what does all the sensory input to the brain look like, what does the nutrition look like, what does the gut health look like, how is the child able to detoxify, is there any nutritional deficiencies? Once we can put all that together, then we actually start to address that. Now, the cases that we see in these kids are cerebral palsy, being able to help these kids with getting better coordination in their legs, or potentially maybe even going from a wheelchair to walking. Dyslexic kids, being able to help these kids actually be able to read. Something very interesting about dyslexic kids is that when we actually do the eye assessment, they can't really track very well with their eyes. ADHD, we've been able to actually find these areas of the brain that are underactive, which is why the brain can't calm itself down. And then you look at autism and you're seeing the same thing. You're seeing these underactive areas. For example, there's an area for these kids that are nonverbal, they can't speak. It's called Broca's. And what we're finding is this area has a very, very low brainwave activity. So the area of the brain that controls speech is really, really weak. So if we don't target that area, these kids potentially might never be able to speak. So our goal here is to, my personal goal, which is actually my book, Cracking the Code of Autism. It's a book to try to help a parent find the hidden voice in their child, is to teach these parents that, look, there is a solution. The brain is actually the solution, and we need to address that through running laboratory testing, seeing exactly what's going on in the brain, and then actually having a very comprehensive neurological exam. And then once you can actually do these, we apply these methods, then we can actually start to help these children actually become, potentially the kid that these kids deserve to be. So one of the things with autism that's kind of challenging is if you get a kid who's like really, really scared. So sometimes it's kind of hard for us initially one is because the kid feels threatened. He doesn't feel safe. So sometimes we actually it might take us a couple of days for the kid to actually realize that, we're safe. We're not here to harm the kid. And really that's a big challenge. The other thing is that these kids diet. These kids literally eat the same thing over and over again. And what's happening is these kids are becoming malnourished, meaning they're getting vitamin mineral deficiencies that are very crucial for the body to actually do what it needs to do. So, one is trying to get these kids to do diet modifications, getting these kids to take nutritional interventions, and then some of these kids just trying to actually even get close to actually even assess the kid. Because sometimes we can't actually assess the kid because they're too scared. Working with traumatic brain injuries, the goal is to actually figure out exactly what areas of the brain are underactive. So after we actually do the proper testing, look at all the electrical activity, the brain waves, then the next goal is to actually look at something called the brainstem. This is where all these nerves that are going to come from basically our senses, how well we see, how well we hear, our facial tone, this vagus nerve, these are very crucial because the brain has to pass through something called the brainstem before it goes into the spinal cord to actually go to a nerve to the arm. So what we found is actually by drawing energy from the brain down to something called the brainstem, down through the spinal cord, out through a nerve, that we found that has been actually a very unique way to actually treat patients who have paralysis following a traumatic brain injury, or even some of our patients are actually developing tremors. They have this brain injury, and then all of a sudden they can't stop moving their hand. And it's the same method, the same technique, the same approach, is that we want to know exactly what's going on in the brain, what's underactive. Can we basically find that and then trying to apply stimulation to that area of the brain? And then we actually use our NeuroSolution laser, which is this red light, and we'll actually put this red light actually on the area of the brain. And what this red light does is it improves blood flow. And if you improve blood flow, you can improve function. And then the next concept is this multimodal sensory stimulation. What wires together fires together. So if we find all these weaknesses and we stimulate them simultaneously while we address this area of the brain that's underactive, then we can have a better chance of actually getting this arm or leg to actually move or even stop tremoring. Yeah, so what happens in emotional trauma, for example, maybe a mom had lost her child, or maybe someone was involved in a horrible accident, or maybe even someone witnessed a death. What happens is the brain sees this, and that sends this crazy hyperactive signal to the brain. And it's actually something called a high beta wave. And that brain wave burns stuff out. So what can happen is these patients could literally start developing autoimmune diseases, which is where the immune system can start attacking their skin, maybe develop rashes. Maybe they can't sleep at night. Maybe they get so stressed out that they actually start getting digestive issues. Some of these patients might even start developing high heart rate or high blood pressure. And that's because the brain itself, it sustained this very, very traumatic event. And the brain right now, what it is, it altered the brain waves. So our goal is to take the brain in this high beta wave, this fight or flight mode, and actually bring it down. And we have to make the brain feel safe because that person doesn't feel safe. And if you don't feel safe, then you're going to be scared of everything. Even if something drops, you're going to be frightened. And that actually brings out something called a return reflex. It's all called a startle reflex. And until this reflex actually goes away, then the brain itself is still going to feel threatened. We have a multi-specialty clinic. So, our neurologist can basically, depending on medications, she needs to prescribe that, on the behalf of myself. What I really want to know is actually what is the root issue? And that way we can address that. So sometimes medication actually can get a faster result. But at the end of the day, what happens is we want to know exactly why do you have this in the first place so you're not on this medication your whole entire life. And so in saying that, the goal here is to actually find the root issue, address that so the symptom can actually go away. Yes. So, one of my favorite cases to actually work with are actually patients who suffered spinal cord injuries. Okay, so these are people that basically maybe they had a motor vehicle accident, maybe they had an infection, maybe there was a surgery, and what happened is it was to the spine. There was trauma to the spine, and they lost the ability to typically move their legs. And what I have found, and through using NeuroSolution method, is that if we take this whole brain-body connection, and I look at this area of the brain that actually controls their muscles, and we actually find that all these patients, this part of the brain is underactive. And if we address that and we can draw energy from the brain all the way down to the area of trauma, then we can actually start to improve function. And the more function we start to improve, the more energy that can actually go down to the legs. So, I work with a lot of spinal cord patients that were told they're never going to be able to walk again. And, this person, their mom, their dad, maybe they're a professional athlete or a business executive, they want to be able to walk. And, I think that sometimes it's disheartening that, people lose hope, the fact that, this is how I'm going to live. And the cool thing about the brain is there's something called neuroplasticity where the brain can adapt to the sensory stimulation. But if you don't stimulate the brain and you only work on these nerves and they lost the connection between the spinal cord and the brain, how are you going to basically adapt the brain? You're not. So you want to draw energy from the brain down to the spinal cord, down to the nerve to try to help these patients. So, I have a really amazing case in the States. His name's Ben. Ben actually was a father. He actually had a beautiful daughter. And he told me on day one when I did the evaluation, he said, "Look, doc, I just want to walk my daughter down the aisle." He goes, "When my daughter gets married, I want to walk her down the aisle." And he says, "All the doctors are telling me that it's never going to happen. I need to welcome this new life to this wheelchair." And he says, "I'm not willing to accept that." And he asked me, he said, "Would you be willing to help me out?" And, and I'm looking at his MRIs and I'm looking at his MRI report and I'm like, based off of typical neuroscience, like this doesn't look good. I said, I'm willing to, try and see, but, just to tell you that the outcomes to this don't look too good. But, let's see. And when I assessed his brain, that area of the brain, it's called the motor strip, was underactive. So once we started getting this area turned on through using red light and all these other modalities, and then we started working on the area above his injury, and we started using this red light therapy to his spinal cord where the injury was, this guy was actually able to start getting function. And now after 7 months, this guy is actually walking with a cane. In the States, I'm actually co-founder of a video game company. It's called NeuroSage. And what we do is we use eye movements and music therapy in the form of an entertainment. So we use virtual reality, we use 3D, 2D video games. And, my goal is to actually take this NeuroSage video game and actually get this into the homes of individuals. So that way these families who have kids with ADHD, dyslexia, autism, or even parents who have headaches and migraines and chronic pain, we've developed video games that can actually, they can be fun, they're entertaining, but they're also very effective in improving the overall health and wellness of the brain. go back to take depression, for example. So what is depression? And when we look at from clinically, what I see is that when we scan these patients' brain, there's a lot of underactivity in the left frontal lobe. And the left frontal lobe, what it does is it's where the highest concentration of dopamine is. So dopamine is going to give you your motivation and your enjoyment of life. So if you're depressed, you basically lost your passion, you lost your energy, you lost your why. So if you target this left frontal lobe, you can actually start to enhance function. The next thing is actually looking at what's going on in the gastrointestinal tract. And we're finding that if you research depression and gut-brain connection, you're going to see that there's actually an issue with there's inflammation in the gastrointestinal tract, which is directly impacting the actual brain. And then the next thing is the brain chemicals. So you have something called serotonin, you have dopamine. These things are also very low in patients with depression. So if you don't address these actually brain chemicals that actually create the mood, then you're going to be depressed. So from running basically a brain scan, running basically proper laboratory analysis, we're going to find all these clinical actually red flag markers, and we're going to address those. And if you address these underlying factors, then the body's actually self-healing and it can restore itself if it's properly managed. What I've seen clinically, I work with a lot of families from the Middle East that have been coming to the States, and these parents are telling me that, they're tired of searching for, they're putting all these home care exercises, they're going to all these doctor visits, and their child's not getting better. And, I want to tell these people, these parents that are out there, is that don't give up, that, there are things that you can do, but it really starts with actually understanding what's going on in your child's brain. And so, our approach is to actually tell you exactly what areas are underactive and what areas aren't. I had a family actually here from the UAE that came into the States, and their little daughter was actually in a wheelchair, and they just want her daughter, she was like 6 years of age, and they wanted her to walk. And, she's been doing all this electrical stimulation on her legs, her back, and, for 6 years, and nothing basically, actually 6, it's been 5 years. So whenever I went to go scan her brain, the area that controls literally her leg was completely underactive. So when I shared this with the mom, and then I actually show her the actual anatomy of the brain, like literally where the foot was, and I showed her that it was so underactive, I was like, look, it's not that what the therapists were doing was wrong. It's just that the brain itself was underactive. And if you don't specifically target this area, it's kind of like, give you the example, it's like going snow skiing. Okay, it's a lot easier to get to the top of the mountain by literally getting on a ski lift and going to the very top versus actually fighting gravity and putting on some boots and a chisel and climbing your way all the way up. And I tell people that's the method that we're actually using, is that we want to go to the top of the brain and we want to get a good broad overview as to what's basically working, what's not. And then we want to chase all these neurological pathways down versus going to the bottom of this mountain and trying to climb all the way up. You're going against the flow of gravity. So you want to facilitate basically gravity, which is a top-down approach, in order to try to get someone to actually get better, or at least get their leg or their arm to move. I wrote a book, it's called Cracking the Code of Autism, and it's a parent's guide to find the hidden voice of a child. And really what it is, it's basically 13 years of research, basically from all the kids that I've seen from all over the world, and just talking to all these parents. These parents, they told me that, Doc, I've spent hours basically researching, when is my kid going to speak? Why isn't my kid speaking? Is it something that happened to me? Is this genetic? And, it's basically... It's 17 chapters. It took me 3 years to actually put this book together. And the goal here was just to give parents all the information so the way they're not having to spend so much time researching. This thing talks about the brain. It talks about the different areas in the brain that are underactive. It talks about all the different therapies, all the different nutritional interventions, all the diet. It talks about something called the sinus-brain connection, the sinus-gut-brain connection. And it even highlights something called ochratoxin A, which is actually clinically all these kids from all over the world that I've tested, I've found that they actually tested positive for ochratoxin A. It's this fungus. And then the other thing is that it highlights primitive reflexes, which are these infant reflexes that basically prevent the brain from fully maturing. And, anyone out there that wants to know about autism or potentially, how to help a child, potentially that's nonverbal, cracking the code of autism is a phenomenal way to actually get started. The interesting thing about, our method is that we have 68 countries that are actually flying from the world in. And the interesting thing is that social media and referrals are actually, how these patients find us. And so the reason why I wanted to come to Dubai is, one, the leadership here is just incredible that, they're trying to bring in everyone, but it's also one of the largest melting pots in the entire world. So on our behalf, our goal was, in order to bring this new method and all this new cutting edge, was why don't we actually come to Dubai and actually be part of the actual innovation and the revolution of healthcare?